Hello everyone, this is Shalli Kumar again from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. In today's video, I'm going to be talking about the new changes and additional syllabus NMC has announced to add to the NMC Adult OSCE exam. So I'm going to be talking about that today. So if you like my videos, please press the like button and also subscribe to my channel. So let's talk about what are the additional changes. Okay, so NMC has recently announced that there is going to be addition to the syllabus, to the content of the adult NMC OSCE exam. Okay, so we're going to be looking into that today. I will tell you what are the main additions and also give you the new marking criteria and how to prepare for these stations. Okay, so we will talk about that. So let's talk about what is the changes. The first thing is first, the addition to adult NMC OSCE exam content is effective from 17th of October. Okay, so if you're taking your exam on 17th of October or afterwards, this will apply to you. Okay, if you're taking your exam beforehand, nothing is changed. Another thing to remember is the OSCE exam still is 10 stations. Okay, I don't want you to panic. It's no more stations, it's just a more syllabus to learn, but there aren't more stations. So you're still only going to do 10 stations as before. So your 4 stations are your API, which are connected to one scenario, which is your assessment, planning, implementation and evaluation on a patient. And then you're going to go ahead and do 4 clinical skills, and then you will do 1 professional behavior station and 1 evidence-based practice. So nothing is changed in that. You're still going to only do 10 stations. Okay, so that's I want you to be clear about that. Okay, so the main additions, now the addition is to the addition to the syllabus. Okay, so I'm just only going to talk about the what are the additional things. Okay, means existing things are already there, so you have to prepare for those, plus now you have to prepare for these additional content. So what is the additional content? The main thing is so there is a addition of more clinical skills. So they have added more clinical skills. They are going to be adding, second thing is adding more topics to your evidence-based practice station, and also the more topics to your professional behavior station. So you will still only be do 1 station each, but you just have to learn bigger content. Your scope of your syllabus is much bigger, so you will just have to put lot more time aside to practice your stations, to learn these things. Okay, so that's the biggest change. Also there is another small change, which is they're adding little bit different scenarios, like about Alzheimer's disease, about homelessness. So those are additional ones as well. So you have to think about preparing for those as well. So just keeping in mind that there can be additional scenarios around those. Okay, so those are the main changes. So now let's just look into a little bit more detail what these changes mean. So what are the additional clinical skills? Okay, so on my next slide you can see administration of suppository. Okay, so to an adult patient, so that is your new skill they have added. So that can be part of your exam, you have to prepare for it. So it's a 10-minute station. Another one is stool assessment or bowel assessment. So they give you a stool chart and you just have to work out, do the stool assessment, and give some health education to your patient. So that is 8-minute station. And then the next additional skill they have added in is nasopharyngeal suctioning. Now we all do suctioning as nurses on our patients, so this is just showing your examiner how to do safe and effective suctioning. So that's 8-minute station. Another one is nutrition assessment. So this was always kind of part of OSCE in community scenario, where you were asked to complete sometime a malnutrition universal screening tool. So it's the same assessment, but this is a little bit more in detail now, and you have to learn that. So that is another 8-minute station. And the next one, 5th one, is oral care plan. So it's how will you look after your patient oral care. Okay, so they could give you different scenarios and you have to answer on based on those scenarios. How will you look after a patient with oral care? So how will you provide oral care to a patient? So that's 8 minute station. And the next one is oxygen therapy. Okay, so because oxygen is counted as a medication, so we need to be safe and effectively administering oxygen to our patients. So again, nothing complicated, but it's just a station you have to now show competence in, and that is 10 minute station. So these are additional to your existing skills which were already there. Okay, so that list is already there plus these ones now. So you would still be only doing 4 skills, but you just have to prepare for a lot more syllabus. It's like any exam, they just have increased the syllabus. Okay, so those are the 6 new stations which are going to be added in from 17th of October. So you have to prepare for them because it may come in your exam. Okay, so next thing is what are the evidence-based practice topics they have added in. So they have added in quite few actually. So the first one is ankle sprain, and then is Asperger syndrome, and then bedside handover, cervical screening, cranberry juice and UTI, dementia and music, fever in children, obesity management, restraint, and saline versus tap water. So these are the new topics you have to research around in your evidence-based practice. So your scenarios can be based on one of these stations. They're all still going to be 10-minute written station. Okay, so these are extra topics in addition to your 5 topics you already had. So now you have to prepare for a lot more, about 15 topics. You have to think about, learn about, research around, so you know what is the evidence-based practice. Of course, they have test centers have released the marking criteria, so you know that's there to help you and guide you as well. Okay, so I don't want you to panic too much. Okay, but it's just now putting aside more time for preparation for this exam. Okay, so the next one is about your professional behavior topics. What are the additions? Again, they're all still 10-minute written stations. So the topics are bullying, concealment of bed status, full representation, falsifying observations, falsifying your timesheets, hospital food, impaired performance, laboratory results, and then racism, and then witnessed abuse. So possible abuse was always a part of your topics. Now they have added witnessed abuse as well. So these are addition to your 5 topics already. So these are the new topics which can come in your exam. So you have to think about it, prepare about it, and practice about, and so that you are confident that you're in your professional behavior station, it will be out of these 15 topics now, 10 plus 5 before. So what I have done is, for ease that is clear to you, I have attached the new timings for all the stations, including the new additions of all these stations. So the timing I've attached it to the description of this video, and also new marking criteria, which is version 6. So make sure now, if your exam is on 17th of October or after, you are using this marking criteria, and you are doing your practice within these time periods, which I have attached the attachment to this video. So like I said, nothing to worry, you can still do it. You're all great nurses, you know what you're doing. It's just that you have to just like I said, just put aside a little bit more time for preparation for your NMC OSCE exam now, because the content is a bit bigger. So but you know, you've done plenty of exams before, I'm sure you can nail this one. And of course, I will be helping you with these new topics as well, and I will be releasing some videos soon. So I just wanted to give you this update, and hopefully now just make sure that you are using the new criteria, which is effective from 17th of October, and new timing. So I will soon be back with another clinical skill videos for you. So bye for now.